to Danya Jimerson on the Wastewater Needs Assessment team to introduce board member Morgan for opening remarks.
Thanks, Ariana. Welcome everybody and good morning. I am Danya Jimerson, a senior engineer with the Division of Water Quality, leading the Wastewater Needs Assessment effort for the State Water Board. Due to the importance of the Wastewater Needs Assessment Advisory Group and its objectives, Water Board staff are present today to publicly affirm their support and the project goals, and they strongly recognize the significance of the work and they offer coordination and assistance where it's necessary. So specifically today, I would like to acknowledge the presence of Chair Board Member Joaquin Esquivel, State Board Member Nicole Morgan, Chief Deputy Director Karen Mogues, and Assistant Deputy Director Annalisa Quijara, and our Wastewater Needs Assessment Executive Sponsors Christina Shoup and Ben Letton from Region 5 and Region 6 respectively. So, and with that, I will now leave you with State Board Member Nicole Morgan, and who would like an opportunity to share her thoughts and her passion and commitment to this advisory group meeting and the goals of the Wastewater Needs Assessment. Thanks.
And good morning, all. It's an honor to be here and welcome you to the second Wastewater Needs Assessment Advisory Group meeting. It is also great to see so many with varying experiences and interests. I often say for each problem, there are many pieces of the puzzle that need to come together to find a solution. In this case, each of your voices is a piece of the puzzle that we need to weigh into the process to successfully move this project forward. We not only need to hear from those with a technical background, we also need to hear from tribal members, community members and leaders, academia, students, interested parties, and others that are interested in improving the access to sanitation for all Californians. While the Wastewater Needs Assessment team has tried to minimize overly technical details, if a topic still appears to be technical, please ask questions, offer input and your opinion. Our goal is to foster an equitable and inclusive meeting environment. The team has been going through our records and talking to local agencies to identify where all the wastewater systems are located throughout the state. This includes communities that are served by individual or community septic tanks, septic systems. We also go through this process. As we go through this process, please let the team know if there are any additional communities that you know of that also need to be included in the assessment. We welcome you all to share your insights during the breakout rooms today, and please also talk freely amongst yourself in between meetings. These discussions will enhance the support for communities working on wastewater projects and ultimately contribute to the overall goals of the Wastewater Needs Assessment. Again, I welcome you to today's meeting and look forward to the discussions ahead. I also just wanted to take a moment to thank everyone for sharing their passion and why they wanted to want to be here today and to contribute to the overall goal of this project. It was really great to hear about what brought you to this critical project. So thank you so much. Really looking forward to today.
Thank you, Board Member Morgan. We really appreciate your opening remarks and the board's excitement and support for this project. And thank you, Danya, of course. Okay, so first, for this advisory group meeting, we wanted to provide a overview of the project and where we are at currently. Today, during the presentation, we'll review phases 1B and 1C. Phase 1B is the baseline assessment of existing sources and the baseline survey by UCANR, which is the University of California Agriculture and Natural Resources, which they conducted that survey. We'll discuss these efforts in more detail later on in the presentation, and we are currently wrapping up these efforts and anticipate the full reports to be released in January 2025. However, we did send over the executive summaries for these reports along with all the meeting materials to the advisory group. Phase 1C is the initial data collection efforts to identify types of data needed and potential sources to identify wastewater systems that will be analyzed in the risk and inadequacy assessment. This has been led by Sacramento State's Office of Water Programs, and we anticipate that Phase 1C efforts will be completed by the end of this year. We are currently working on Phase 1D. However, we will discuss these efforts in more detail at the next advisory group meeting in January. The risk and inadequacy assessment will establish criteria to label struggling and out of compliance wastewater systems. And the last effort of Phase 1 is the solutions framework. Based on the definitions established from the risk and inadequacy assessment, we will establish a list of solutions for different types of issues. Phase 2 will begin in September of 2025. I won't dive into every task of Phase 2, but the effort largely encompasses longer-term data mapping, system of concern identification, long-term solutions, and affordability estimates, as well as developing a roadmap for after this assessment ends. So that's where we're at now. I'll now go over a brief overview of what the meeting today will look like. So first, we're going to have the contracted team provide an overview of the research conducted thus far, with the three main topics being the baseline assessment, the data collection efforts, and potential terminology for individual sewage systems. Then we'll do a breakout room activity with the three breakout rooms based on the main agenda topics. In the breakout rooms, the Wastewater Needs Assessment team will act as the facilitators and note takers, but we are asking that one advisory group member in each breakout room volunteer as a reporter to share out after the breakout session what their breakout room discussed with the larger group. And so Anna, our graduate student researcher at UCLA, should be putting in the chat right now the breakout room document, which includes the discussion points for the breakout rooms. And so we will manually place you in the breakout rooms after we have a brief break after the presentations. Anna will also place the breakout room assignments in the chat. We had emailed this out to y'all to self-select which room based on the topic you would like to be in. For those who did not respond, I manually placed you into a breakout room. But if you want to change your room, please leave a comment in the spreadsheet and we'll try to accommodate when assigning rooms. We just want to make sure there's around 10 advisory group members in each room. We don't want one room to have too many and one room to not have enough folks in it. So, but if you're placed in a breakout room and would like to provide feedback on another topic, or if two topics are very interesting to you, but you can only be in one breakout room, we're providing a form for after the meeting so that you can provide direct feedback to the Wastewater Needs Assessment team. Okay. And so, based on the breakout room that you are placed in, there are differing levels of expectations for the feedback provided. So for the baseline assessment, there is generally no expectation to provide direct feedback, say on the reports or the executive summary. But the Wastewater Needs Assessment team will consider feedback on this effort for future parts of the work. For the data collection efforts, the expectation is to receive feedback regarding potential data sources and future data collection efforts. And for the individual sewage system definition breakout room, the expectation is to receive feedback on the working definitions and potential ways to improve those definitions. So I'll pause and see, I can maybe take one or two questions. However, after the presentations, I'll go into more detail about the breakout room format. So yeah, I'll pause for questions, but just know there's time for questions later as well. Okay. I'm not seeing any questions. And I probably will not be able to look at the chat since I'm sharing my screen. but please feel free to put questions in the chat and hopefully other members of the wastewater needs assessment team can answer that for me.
There are no questions in the chat at this time.
Thanks, Greg.
Mhm.
Cool. Okay, if there's no questions, then we can begin the presentation portion of this meeting. So first, I'll share the work we've completed for the rapid baseline assessment existing studies review. And Anna, if you could please put the executive summaries for the baseline assessment in the chat. And so just again, thank you, Anna, for all your work and your help today. Okay, so for the baseline studies review, we conducted a survey of existing knowledge as a traditional literature review approach was not relevant. So our guiding question was, what is already known about wastewater needs and sanitation equity in California? This effort is supplemental to the baseline survey efforts, which will be discussed after this to establish original data statewide regarding sanitation gaps. We reviewed engineering reports, other needs assessments, and tangential published studies and reports. This review was not only to better understand wastewater needs and equity in California, but also to differentiate the wastewater needs assessment from and to make sure we avoid the duplication of the many other current and recently conducted efforts. We reviewed these reports for information on wastewater system mapping efforts in California, methodology to determine geographical hotspots of wastewater concern, previously used criteria and definitions for inadequate or at-risk wastewater systems, cost and affordability estimates in terms of wastewater solutions, and statewide need funding estimates. So we found that existing efforts can inform the wastewater needs assessments, but do not replace the need for the wastewater needs assessment itself. Existing sources are limited in their relevance, accuracy, and coverage of wastewater needs in California. So first, we reviewed the Clean Watershed Needs Survey. This is a comprehensive assessment of the capital costs required to meet the water quality goals of the Clean Water Act and address water quality and related public health concerns. The Clean Watershed Needs Survey, also CWNS, primarily focused on larger communities due to easier access to information and therefore underestimated the cost for smaller wastewater systems. The Department of Water Resources Regional Needs Assessment. These assessments are another important and similar sounding effort. These regional needs assessments are part of the disadvantaged community tribal involvement efforts, which are part where each of California's integrated regional water management regions, and there's a lot of acronyms in there. So each of them developed an individual funding area needs assessment. So this amounted to around 10 individual needs assessments reports for each region in California. And so the methods of these needs assessments vary by region and typically just generally and broadly describe issues of wastewater needs. However, some individual regions like the Tulare-Kern, North Coast, San Francisco Bay Area provide more details on their wastewater systems and the wastewater systems needs that can benefit the wastewater needs assessment efforts. We also reviewed 6 septic to sewer scoping studies ranging from 2014 to 2024 in California. It was hard to find even the studies we identified, which are admittedly few. Septic to sewer studies quantify the prevalence of on-site wastewater treatment systems, commonly referred to as septic tanks, within local regional areas, along with their risk of failure and the estimates for cost of connection to sewer collection systems in the area. While these reports are informative, they have limited geographic coverage and likely represent particularly proactive agency partners. Additionally, but not listed here, we reviewed some tribal-focused studies in California. We did not find any studies that were fully relevant to the wastewater needs assessment, but did review housing equity studies in California, which described household plumbing needs, and a federal drinking water and wastewater needs study. These reports have limited wastewater specificity, but they do highlight the gap in tribal wastewater needs and highlight key issues like access to adequate sanitation in tribal communities. And The last thing that we reviewed was we considered funding sources to address the cost of solutions for inadequate systems. Most external sources of funding for wastewater systems and infrastructure in California is routed through the Water Board's managed Clean Water State Revolving Fund, CWSRF. At the state level, the Intended Use Plan, IUP, is prepared annually and published publicly to account for how the CWSRF will be used during the fiscal year and helps to prioritize projects. Generally, wastewater funding and wastewater equity funding lags behind the drinking water side. Recent and current IUPs clearly motivate the need for more costing and funding for wastewater solutions in California, especially for small disadvantaged communities. Existing funding levels, even with recent state one-offs from budget surpluses and propositions, cannot meet current needs, much less the level of need identified in the Clean Watershed Needs Survey, or which we are likely to identify in the efforts of the Wastewater Needs Assessment. So that's all I have for the baseline assessment of existing studies. If you have any questions about this assessment of existing studies, we will have more time in the breakout rooms to discuss. Now I'll hand it over to Sam to discuss the Rapid Baseline Assessment Survey. And Sam, I have given you slide control permission, so you should be able to click through the slides, or I can click through if that's easier.
Thank you, Ariana. When I saw that I was having control of the presentation, I had a tingling feeling of moving things around, but I kept my self-control. Good morning, everyone. Buenos dias. My name is Samuel Sandoval. And today, as part of the UCA&R team and the larger team, this has been truly a team-wide effort. I'm going to present you the baseline survey. The baseline survey is part of the Rapid Baseline Assessment. Let me see here. Ariana, oh, no, I was able to do it. Yeah. So the baseline survey is divided into 3 parts. The first part is the survey in itself. And basically, the objective of the survey was to understand community-based needs for water-related sanitation access. We administered this survey to so-called experts or community leaders in order to gather this information and to develop this rapid baseline assessment. This part 1, well, basically, we're going to present you today results of this survey. The next part was the spatial analysis. So we start georeferencing, start collecting georeference data. From the survey, from part 1, we were able to, whenever they told us or mentioned specific sites, we were able to map them. And in addition, we were able also to gather key data types, key types of communities and housing. The overall objective of the spatial analysis is analyze the data for trends and clustering patterns. And also this spatial analysis will help us on part 3, which is the field campaign to figure it out where we are going. So the spatial analysis, that database will be publicly available for everyone. And then in part 3, what we're going to be doing is to ground truthing, to see all this information that we have received, to document it by visual inspections. Also, we're gonna fill again back a rubric. We're gonna take pictures and we're gonna have conversations. This is putting the story on the data. What you're gonna see this time is the data. Later, we're going to try to put the story behind the data. Today, we're going to be looking at part 1, the survey. I'm going to provide you an overview of part 2, the spatial analysis. And the field campaign is coming soon, is the second part of the sequel here. So please stay tuned. Now let me go here. So in terms of the survey is a qualitative tool and we obtain quantifiable data. Basically, the quantifiable data was in 2 different rubrics. The first one is in the definitions of water-related sanitation and water-related sanitation equity. And the second one was on describing the issues that communities are experiencing related to wastewater needs and obtain the experts' opinions. The questions were multiple choice. It was an online survey, and it was directed to experts and community leaders. So this is how the overall picture of how the survey looked like. There were 6 different parts of the survey. The first part is just introducing. What was the survey about? What is this project about? What are the objectives? The second part, we ask about these definitions of water-related sanitation and water-related sanitation equity. We collected feedback. Actually, last time in our last AG meeting, we also sent you those documents, and you already provide us feedback on that, in those 2 specific definitions. Then we ask in the survey if the respondents knew a community that had a water-related sanitation issue. And they start listing what are the communities that they had an issue. And then based on that, they start characterizing each of these communities. For each community and the sanitation issues, we start collecting the issues there. The part 4 are actually the issues that we ask the respondents. If they have access to sanitation, access to sanitary plumbing, non-functioning sanitary plumbing, access and use of portable toilets, sewage systems, and access to running water. For each of these issues, we identify size, temporality, persistence, impact, and exposure of risks. So that was quite a lot. And then they'll have to do it again for each of these communities. So that was, we should really thank the people that filled this survey. Community and government actions. So if they knew that there was any community or government actions to solve these issues, and then we asked for either contact other people that we should send the survey. This was a snowball survey, a snowball method, or if there was any literature review that we wanted to read. We sent it first to 108 experts. That was our first, and then as the snowball and we were collecting more, we were identifying other experts and community leaders. The last number that we sent it was 166 respondents. You can see on the left the distribution of those. Mostly half of them, they were from advocacy NGO groups. 25% were from the academics. So those are the 3/4. The others is between government, TA providers, private, and journalists. Now, of those 166, we have a 67% response rate. What that means is that 112 actually answer our survey. And of those, 112, 63%, so 71, provided information of a given community and what were the issues of water-related sanitation related to that community. The other 37% opened the survey but say that they didn't know a problem related with water-related sanitation. Sorry. So from now on, now you're going to be, these are the results of the survey. If you want to discuss more about the results, or if you want to provide feedback, or where should we go into the field campaign, please let us know on the breakout group. But from now on, we're going to present results. So these are the definitions that we adjusted based on the feedback of all these people and your feedback. Water-related sanitation is the access to safe, functioning, affordable, and dignified collection and disposal of wastewater from human uses, domestic and industrial, including adequate sanitation systems, practices, and wastewater treatment to protect public health and the environment. And each of these nouns and each of these adjectives we also have a definition, a extended definition of it. For water-related sanitation equity, is achieved when attributes, and the attributes are social, geographic, economic, cultural, and demographic, no longer predict people access to or quality of water-related sanitation. So those are the two definitions that we come up. If you want later, we can provide you all the specific other definitions of the adjectives and nouns. Now, here we go. Now, in terms of survey results, basically the people that responded, the 70% of the people that responded the survey mentioned that they were either living in the community or had a professional relationship with the community, and they feel responsible for it. What that means is that 70% of the people who responded are telling us this firsthand. There is other theory that they were reading or secondhand, but these are the results from those respondents. They mentioned that we have long-lasting issues related to water-related sanitation issues. What does that mean? That 80% noted that the issues have occurred for 10 years or longer. In terms of where this is happening, of house types, most of them are occurring at the family residences, 44%. And those can be single or multifamily residences. And also that they are occurring in recreational vehicles and mobile home parks. These account for 74% of the housing that we collected. In terms of socio-demographic factors, the water-related sanitation issues does not identify ethnicity. It happens to everyone. So 34 are non-Hispanic white or identified as non-Hispanic white, 28 as Latino, Hispanos, and 18 mixed. We were surprised about the non-Hispanic white, and basically between the on-house people living in RVs and mobile home parks, that account for that. Latinos were mostly on farm housing and disadvantaged communities, also non-Hispanic white. So that is part of the results. In terms of communities, the respondents, 84% of the respondents mentioned that the communities that are experiencing these issues, 84% meet the statewide criteria for disadvantaged communities. So these are occurring in these issues of wastewater are occurring in disadvantaged communities. Now, what are the common issues? We've been talking about issues of wastewater. What are those issues? 38% respondent that is related to septic systems, to non-sewer systems. 13% of no or intermittent water supply. No water supply, no wastewater service. And the last one is reliant on mobile toilets. So those are the three most common issues. They account for 63% of the issues. We can talk about the following one. Now, the most common issue was septic systems, 38%, and of those, most of the problems, 2/3 of the problems are related to maintenance. In terms of what we were talking about, right? Like you don't have access to water, you don't have access to wastewater services. And in this case, this is occurring mostly on the on-house encampments, the on-house community, because they have no or intermittent water supply. In terms of mobile toilets, basically communities that are relying on mobile toilets, 33%, they rely at work, and the other 33% at all times. So these communities have don't have access to permanent toilets at least certain part of the time or the entire time. In terms of mismanagement, there were few respondents that mentioned this, but there are locations where raw sewage is spilling into water bodies or land, and those are closely to family residents. The same no limited access to toilets. In this case, is mostly from the on-house community, and that these problems have occurred for longer than 10 years. No indoor sanitation plumbing, the same, it was very few respondents mentioned this, but those indicated that are occurring in the homelessness community. In terms of assistance, so that was the last portion. What type of assistance the communities are reaching out? So 22% are technical, 21% are financial. So these are the results, the summary of results for this part of the survey. We send you a fact sheet in English and Espanol, so you can share it with it. You can take a look at it. Report is coming soon. We can discuss it. Now, that was the first portion, the survey. Now we're going to the middle one, which is the spatial analysis. And basically, many of the results that we had from, let me see, there we go. Many of the results that we have for the survey, they came with a location. They mentioned to us a location. So basically what you see on the right is the map where some of the respondents mentioned there is a wastewater, water-related sanitation issue. And some of those, they were really broad, like all communities within 5 miles of the coastline or all communities in the San Joaquin Valley. But some others responded very accurate. Is this a specific ranch, this a specific community, this a specific location? So we map all of those. So now this part, what we want to do is to having a map where we're having issues so it can inform the following part, which is the field campaign. These are the results from the survey. And then we collect information, geographical information of communities that might be at risk. And those can be mobile home parks, RV parks, disadvantaged communities, tribal disadvantaged communities, farm housing, employee housing, and then campgrounds, national and state parks. We're going to use this information either to understand if there are trends or clusterings and to inform part 3, which is the survey. Here we go. This is part 3. And basically in here, what we are doing, what we're going to be doing is using the previous information to go into a field campaign, to travel the state, to have a visual inspection. We're going to develop a rubric based on our survey. We're going to improve the characterization of what we are seeing on that. We're going to also look to other places. Whenever possible, we're going to take pictures and we're going to have conversations with the people living here. For us, it's really important to bring the stories to all the information that I just provide you, to listen in firsthand what is happening. The challenges of water-related sanitation issues are very different or are as diverse as the state of California is. From problems related with farm housing, mobile home parks, all the way to on-house and so on. So our field campaign will start in November 1st. We're working on the logistics. It will go through July 25th. Once again, Ariana mentioned this. For this part, please, if in our future work, in the field campaign, if you know a location or if you know a person that we should contact so we can travel around and have a first-hand experience, please let us know. we're gonna have the breakout room. And for us, this is very exciting as part of the entire team. This has been a team effort. So thank you.
Thank you, Sam. And Anna has posted the executive summaries for the baseline survey in the chat. So please check those out. And of course, there will be time for questions in the breakout room sessions.
Okay.
Now I'm going to hand it over to Dakota from the Sacramento State's Office of Water Programs to go over the data collection overview. And as I said for Sam, you should have access to the controls, but if you need me to go through the slides, just let me know.
Excuse me, Ariana.
Mhm.
Is there
I can-
is there a chance that we could this is a lot of information. Can we kind of ask a question right here about the survey itself that was done
We
by
have,
chance?
we are ahead of schedule by 2 minutes. So we can have one question perhaps, but there will be time in the breakout rooms. We have,
But
I
if
think
I'm
40
not
minutes.
if I'm not in the breakout room, the right breakout room, then I can't ask the question.
You, I actually have assigned you to that breakout room, Keith, so you will be in that one particularly. However,
Okay.
if you're,
It's a
In
real
a break-
quick it's a real quick question, Anna,
okay, go for it.
about the survey. Mike, I'm just concerned about the demographics on the survey that it did not include rural housing. Sewer septics are the survey didn't include rural housing. It wasn't included on the list. That was all.
We did that. It is mostly on the disadvantaged communities, but in the housing type, we mentioned that one. I can get at you back, Faith, Keith. But basically, yes, I'll get back at you on those.
Yeah, that's fine. Just get.
Okay,
And I will say, we do have to move on. We did pick this structure of this meeting based on feedback from the last meeting. We will also have half an hour for discussion of everything in one unified room, but people said they would like to have smaller breakouts. So we're trying it this time. We're open to your feedback about how to structure future meetings. And generally, each of these meetings will have a lot of information presented due to the nature of the project, but we're trying to allow for as much discussion time as possible, and we're open to follow-on venues if people feel there's just not enough time in these meetings, but we don't want to overburden or ask too much of your time. So I do think we need to move on now, but there will be time in the breakout rooms and all together later in this meeting and future venues.
thanks, Greg. And I'll post in the chat right now. We have a form, so that say you're not in the breakout room or you're placed in a breakout room, but you have feedback on another session. We are providing a form so that you can provide this feedback for the Wastewater Needs Assessment team. And I could put that in the chat now if you feel like you want to put questions in there. But now it is 10:10, so it is, I'm going to hand it over to Sacramento State's Dakota for the data collection overview. Thanks.
All right, thanks, Ariana. Hello, everybody. My name is Dakota Keene. I'm a geologist here at the Office of Water Programs at Sacramento State. I've been heading up the data collection effort portion of this project alongside my team members, Caitlin Leo, a research engineer here at OWP, and Dr. John Johnson, a professor emeritus of civil engineering at Sacramento State. So today we'll just be summarizing our efforts in data collection and compilation so far. That way we're kind of all up to speed and we can have a great discussion in the breakout room today. So our initial scope of work for this project can be reduced to 3 general steps. First, we had to identify what our data needs and sources were for this project, meaning we had to decide what information we should actually be trying to collect and find out who we're going to get it from or what database we're going to query to get it from. Second, we had to collect and compile all of that data, meaning going through each database, downloading it, removing erroneous data or irrelevant data, reaching out to experts in the field, database managers, program managers, different staff levels, etc., and then work to organize it all into something that's usable by the rest of the team. And then third, we had to identify any existing data gaps. So for any project, there's always some type of information that's missing that the project team would like, but that could get in the way of completing a project. So we had to put in some time to think about what sub-strategies were to get around that missing data and kind of fill that gap. So first, I'll go back to that first step, our data needs and sources. In general, our needs can be thought of as system names, types, and locations, which we'll discuss today, and then additional attributes that we'll identify once the risk assessment criteria has been clearly defined later on in the project. So that blue box, just to focus, these are the data needs that we're focusing on for this discussion. Our primary data sources are the California Integrated Water Quality System, or CWICS for short, regional water quality control boards, we'll just call them regional boards for short, the California Association of Sanitation Agencies, or CASA, and then county health departments. Today, similar to the data needs, we'll only be talking about CWICS and the regional boards. So to dive deeper into data needs for the types of systems, we're really looking at three main types of wastewater systems to collect information about. The first are wastewater treatment plants or facilities. We call them WWTPs for short. These are permitted by the regional water boards. These are places where wastewater is treated and discharged. They're permitted by the regional water boards generally under two categories. There's the National Pollutant Discharge Elimination System permits, or NPDES, for systems that discharge their treated wastewater to surface waters like a lake or the ocean or a river. And then there are waste discharge requirements. These are also handled by the regional boards, and they discharge their treated wastewater to land. Sometimes it's the surface of the land through ponding or spray irrigation. Sometimes they discharge it directly into the subsurface, meaning underneath the ground surface level. The next category of systems is collection systems. So these are all of the pipelines and lift stations throughout neighborhoods that transport wastewater from the toilet to the treatment plant. So this is all of the pipes underneath the sidewalk in any given neighborhood. They're transporting waste after it's been generated. These are also permitted by the regional boards, generally through sanitary sewer orders, or SSOs for short. And the third category is comprised of individual sewage systems and other wastewater treatment systems. UCLA will be discussing some of the nuances of this later on today. These are sometimes permitted by regional boards through the waste discharge requirement permits, but a lot of work has been done to transfer these permits from the regional board's jurisdiction to county or city jurisdiction through the creation of something called a local agency management plan, or LAMP for short. And so to look deeper into our data sources, really we'll discuss the regional boards first. You can see a representation of where each regional board and what portions of counties they have jurisdiction over on the right. The Regional Water Quality Control Boards split the state of California into 9 regions statewide, with their boundaries based off of natural watersheds. These boards are semi-autonomous from the state board and engage in rulemaking and regulation that is appropriate for their watershed-specific challenges. In short, the needs of systems up in Del Norte or Humboldt County are going to be much different than the needs of systems in, say, Orange County or Ventura County. Regional board staff do things like prepare and maintain basin plans, set water quality standards, and issue and then enforce permit requirements. CWICS, the California Integrated Water Quality System, is a database managed by the state Water Quality Control Board that allows regulators and the public to track permitted facilities that discharge water of almost any kind, whether they're permitted via NPDES, WDR, or SSO, those 3 categories we talked about earlier. The database includes general information about the facility, like who owns it, what type of facility it is, and where it's located. And it also includes information about permit requirements, inspections, violations, and enforcement activities. And so here on this slide, you can see a summary of our workflow for data collection and compilation. each of which each box there I'll describe in more detail on the following slides. But first, we extracted relevant system types from the SWRCB database to obtain a working list of facilities. Then we brought that working list to regional board staff members so that they could inform us about the nuances of the facilities in their jurisdiction and maybe some limitations of the database that might affect the information we're looking to obtain. After that, we developed a set of criteria that led us to include or exclude a particular facility so that we ended up with a list of facilities that is consistent with the overall goals of this needs assessment. So to begin, SWRCB is a massive database. California is a big state with a lot of people. There's a lot of water, a lot of wastewater going on. And it tracks all sorts of facilities and permits, and not just those that deal with domestic wastewater. The file that we received from the State Water Board, there's over 90,000 entries in that database. That includes permits for wineries, industrial facilities, commercial enterprises, fish hatcheries, and many, many other types of facilities and discharges. So we had to work to narrow things down to facilities within the scope of this project based on search criteria that are built into the SWRCB database. First, we filtered by a set of programs that are assigned to municipal wastewater systems of various sizes and configurations within those MPDES, WDR, and SSO umbrellas. This brought us down to just over 7,000 facilities. From there, we looked at facility types, subcategories of those programs I just mentioned. We filtered for specifically wastewater treatment facilities, mobile home parks, educational facilities, prisons, collection systems, and domestic sites and residences that are not elsewhere classified. This brought our working list down to just 4,000 entries in the database. So with just using the attributes that are already present in SWRCB, we were able to narrow our scope down substantially. Next, we had to confer with the regional boards. So we created that working list of just over 4,000 facilities. We split it up by region and met with staff from the regional boards to discuss the systems and request their input. We asked them to review the accuracy and completeness of the systems we included and let us know if they had any other additional information for these facilities that's not tracked in this main SWRCB database. Between their review and our own deep dives into the data we discovered that there are several classes of facilities in the SWRCB data that fit our earlier search criteria that I just discussed, but they're not really relevant to the goals of this needs assessment. Remember, our goal is to develop a list of wastewater facilities that collect and treat domestic wastewater. Examples of facilities that don't necessarily match up with our goals include federal facilities like Beale Air Force Base and Camp Pendleton, privately owned facilities like golf courses, hotels, and truck stops, and recreational or day use areas like state parks or RV parks. So after this discovery, we realized that we needed to come up with a specific methodology to, one, determine whether a given facility belongs in our facility list, and two, let folks who work on the next iteration of this project reproduce our work. As I mentioned before, we started by screening the SWRCB database for certain built-in attributes like program and facility type. This gave us a head start on creating a list of facilities to be included and a list to be excluded. So then, based off of the goals of this project and discussions with water board staff and literature reviews, etc., we came up with two sets of methodologies, one to suggest a facility should be included and one to suggest that a facility should be excluded. I'll talk a bit more about these methodologies on the next slide, but to apply them, we had to manually check each associated permit with the facility. Why did we have to read hundreds of permits? It's because the SWRCB categories I mentioned are sometimes too coarse to match a facility to our criteria and actually be relevant to the goals of this assessment. Sometimes a facility name in SWRCB doesn't provide enough information to enable us to classify it. So for example, is a facility called Hillside Estates that fits all of our prior filtering categories a condo development with a community septic tank? Is it a collection of individual homes with a group septic service contract? Or is it a collection of homes with a homeowners association owned sewer and treatment plant? The first two would be excluded while the third option would include it. We wouldn't know without looking up the permit and actually reading into the details that the permit contains. We also had to look for information about a facility to distinguish whether it treats sanitary waste or not. A wastewater treatment facility versus a facility that takes treated effluent and cleans it further to create recycled water for other uses. So this brings us to our facilities list. Our methodology led us to include and exclude the types of facilities that you see in these boxes. Facilities we included are public treatment plants, private treatment plants that serve rural residences or mobile home parks, migrant housing centers, prisons and work or conservation camps, schools, and hospitals. Facilities we excluded are federal facilities, facilities that don't process sanitary sewage, private commercial facilities, transient or temporary use facilities, and private residences. Single and multifamily residences that have a septic tank or similar technology are still going to be included in the needs assessment, but they're set aside into a separate list for the individual sewage system analysis that will be developed later on. So let's revisit our counts of facilities. Last we left off, after filtering for the attributes that are present in CWICs, we had just over 4,000 entries, down from 90,000 at the beginning. Once we applied the methodology I just discussed, we were able to trim things down to just over 2,000 facilities. After separating out the collection systems, because they'll need their own analysis separate from the actual treatment plants themselves, we're left with 973 wastewater treatment facilities to be considered in this inaugural wastewater needs assessment. One of our ongoing tasks is to connect the collection systems we set aside and assign them to their relevant wastewater treatment facility that they actually discharge water to. So to help you all visualize what this looks like, we produced a map and tabulated up the counts of facilities by region and permit type. On the map, I know they're very small, but you can generally see the distribution of them. The red dots represent those WDR facilities, those ones where wastewater is discharged to the land. And those blue dots represent MPDES permitted facilities, those that discharge their wastewater to surface waters like a river or to the ocean. As you can see, there are more than twice as many WDR permits as MPDES permits, 719 WDRs compared to 254 MPDES. And so examples of facilities that are covered by these waste discharge requirement permits include community septic systems with leach lines, treatment lagoons with seepage, and mechanical treatment plants, followed by percolation ponds or surface irrigation sites. There's just a lot more variety in the WDR permits, and so it's expected that there are going to be more of those. We've sent this revised list to the regional board staff for further input, and we'd like feedback from all of you today on our methodology during the breakout groups. We'll incorporate feedback from both regional board staff and the discussion that we'll have today to revise the methodology and subsequent facility list appropriately. This facility list is going to be used alongside the assessment methodology to assess risk to facilities, but that's a topic of future discussion. I'll hand it back over to Ariana.
Thank you, Dakota. Yeah. So now we have potential terminology for individual sewage systems, and I'll hand it off to Greg to start us off on that conversation.
All right, thanks, Ariana. And I'm gonna start us off on this last segment of presentation, although I'll be joined by Stephanie Torres on this, and we're going to talk here about, as it says, potential terminology for quote-unquote individual sewage systems. We put individual sewage systems in quotes because that was the term we used in the first meeting, and a term we have been using on a working basis in the wastewater needs assessment, but as you'll see, a term that we're not going to be using going forward. What is, why were we using the term individual sewage system? What are we talking about here? I'm going to try to spend a lot of time on this, and in some ways this is quite conceptual, but basically we're looking to identify and come up with terminology. Wouldn't even call it so much of a definition, but terminology to describe the systems that we need to be addressing and covering in the wastewater needs assessment that are typically small and serving residential populations, but are not covered by the facilities list. And all the work that you just heard described, massive amount of work, I want to say, just described by the Office of Water Programs. And the reason, if we move to the next slide, we came up with the term individual sewage systems is really because there are so many different terms used for similar types of small decentralized wastewater systems. And the next 3 slides, I'm not going to read all the text. Don't expect you to look at all the text. The point is to illustrate that there are a lot of different terms used for these types of systems. Thus, we need to have a common language and somewhat consolidate our terminology in order to be understanding each other in this space. And again, here I'm just going to mention the different terms, and you may have heard of many of these or not. But sometimes you hear small systems framed as on-site systems, and you'll see later in this segment that on-site systems with some additional qualifiers do feed into the regulatory terminology for California in this space. But often you also hear these types of systems described as decentralized systems or non-centralized systems. Sometimes you also see terminology, and again, you can see on the right-hand side that this terminology is actually coming from US EPA around decentralized wastewater treatment systems or decentralized sewage systems, etc. Probably the most common term, and it's come up a ton of times, in the initial comments and during the survey, is septic system. But this is a particular type of small decentralized on-site system. But septic system is what I think probably the most well-known term in the space that describes on-site wastewater disposal and collection. And then some other times you hear these systems referred to as private, including private sewage disposal systems. Again, these are all not synonyms for similar types of small systems, but not identical types of systems. And that brings us to the 2 terms that I think are most important. We're going to have a deep dive on the first one because it's very important with respect to data collection and regulation in California. Although we also recognize that these terms are complicated and a little bit wonky. But the first is on-site wastewater treatment systems, or OTS, which describes and has its own policy, as you'll hear about in chapter in the California Water Code, describes individual disposal systems, community collection disposal systems, and alternative collection and disposal, wastewater disposal systems, and all of which use subsurface disposal, versus on-site sewage treatment systems, which contain all of the above, but also importantly include cesspools and other types of surface disposal. And again, we'll do a deep dive on on-site wastewater treatment systems in a minute, given their importance in California. Well, that again all brings us to really the last point, that there are a lot of different terms used in regulation and broader advocacy and policy in the small wastewater systems space. There are more terms than we even showed on the previous few slides. And we have to focus on these systems, given that sanitation disparities are, many of them are located in small systems, or people served or unserved by small systems. And there's also a large focus in the wastewater needs assessment on, quote unquote, again, septic to sewer opportunities. Another important point to make is that there are a ton of these systems, and quite a few people in California reliant on these systems. And the most recent estimates, again, for certain types of systems, are that there's over 1.2 million on-site wastewater treatment systems, or OTS, installed and operating in California. I believe Stephanie's presentation in a few minutes actually contains a slightly higher number, but it's a lot. And there's also the best estimate of the number of folks who are not served by sewage systems is approximately 1.6 million in California as of 2021. And again, part of the reason we're focused on this and trying to come up with terminology that we can use and all understand is that there's no definitions in the Clean Water Act or state law or regulation that clearly defines sort of the systems that are on the facility list in a way that's similar to the public water system and community water system terminology that you find under the Safe Drinking Water Act. That both differentiates which systems are regulated, how they're regulated, as well as other types of small systems. And we'll show you that sort of example to close here. That being said, again, we had started to use this individual sewage system term as a placeholder term for this bundle of decentralized small wastewater systems serving residential populations, but we are proposing to move away from that, basically not use it after this meeting, because it lacks clarity, and it turns out after much discussion, both internally within the wastewater needs assessment team and with staff and with some of you all, and based on feedback from you all in the first meeting, that this term was not helpful and was going to cause confusion. So we're proposing not to use that term going forward. That being said, we are still looking to, in the longer term, to come up potentially with new terminology that would better align with a sort of public water system analog that would help us all understand which systems are included in the wastewater needs assessment and which are not, and help also better classify systems in databases like SWRCB, which Dakota referred to. But for now, and again, we're very much looking for feedback on terminology in this space. For now, instead of using the individual sewage system terminology, we're proposing to use the umbrella term on-site wastewater treatment systems plus unsewered populations. The rationale for the use of this term is really that we have clear definitions of on-site wastewater treatment systems and unsewered populations, and there will be data generated or collected on both in the process of the wastewater needs assessment. The on-site wastewater treatment systems coming from reporting from the county up to the state, as I believe Dakota referred to, and estimates of at the parcel level of folks who are on sewer versus not on sewer, coming from the efforts of University of Massachusetts Amherst in the context of this project. And each of these sources of data will be used in the solutions analysis, particularly consolidation and regionalization analysis of this effort. Again, I'm gonna sort of close here by saying we never were, and we were not anticipating proposing an actual new regulatory term to replace existing policies or definitions. That was never the goal. That's not the goal here. Trying to come up with terminology to help classify and understand different types of systems. And we still hold out the possibility of coming up with new terminology that may help both, again, understand broader wastewater facility and system categorization, given the lack of clarity in foundational regulations up to the Clean Water Act, and some of the issues that are found in classification, even in public databases like SWRCB. But we want to note, and again, we found this even internally, we're very unlikely to find an existing term or a new term that everyone is fully satisfied with, in part because of the complexity of these types of systems, but also because coming up with a new term inherently in a space like this is, people are going to have different opinions on. That brings me to the last slide. And again, we're not trying to do this here, but just note perhaps where we may be headed, and show you a little bit of how things are defined and laid out on the drinking water side under the Safe Drinking Water Act. This is done federally and applies across the country. And this is where we also think that helping to classify and come up with terminology that classifies systems could also be of great use, not just in California, but elsewhere. But essentially, the Safe Drinking Water Act defines public water systems, publicly regulated systems of 3 types. I'm not going to read all the definitions here, but community water systems are the ones that really most people are thinking about and most people are served by. Those systems that serve 15 or more connections or 25 people year round. Whereas there are other types of publicly regulated systems, including non-transient, non-community water systems and transient non-community water systems. And then there beyond that, there's a clear distinction for any system, drinking water system or source that serves less than 15 connections. They're not regulated by the Safe Drinking Water Act and are generally called private or domestic wells. We recognize again that we can't just impose, by no means could we impose the system directly on to wastewater systems. We looked at doing that and it simply does not work. But we do think that there's a helpful sort of analog that we may be able to develop in the course of this wastewater needs assessment or for the future of the wastewater needs assessment that may be helpful to this effort, given, again, the diversity of terms used in the space, both for the systems that are clearly permitted and regulated, as well as those that fall into gray spaces. But with that, I want to go ahead and turn it over to Stephanie to give us a little bit of a deeper dive, in particular on on-site wastewater treatment systems, given their importance in regulation and in the small decentralized system space in California. Stephanie?
Thank you, Greg. Hello, everyone. I know this is a lot of information, so I'm going to take a breath. Okay. My name is Stephanie Torres. I'm an engineering geologist of the Waste Discharge Requirements Unit in the Division of Water Quality at the State Water Resources Control Board. I help provide insight to the Wastewater Needs Assessment on the Water Board's regulatory extent of on-site treatment systems, such as regulations on septic tanks. In particular, I help oversee the on-site wastewater treatment systems, the OWTS policy known as the OTS policy, that sets statewide conditions for siting, design, operation, and maintenance for these systems and provides regulatory coverage for the majority of these systems statewide. We hope an overview of Water Board's wastewater regulations may assist and provide some framework for today's discussions. Okay, so to help us understand Water Board, which is the State Water Board and its 9 regional water boards, the regulations for on-site systems, I'd like to first get a higher kind of bird's eye view of, okay, what does the Water Board permit for wastewater? On this slide are examples of waste discharge requirement permits regulated by the water boards, such as sanitary sewers. These numbers here are to provide insight on the types of waste discharge permits and systems the water boards regulate. Please note that the facilities number in particular in this slide is not reflective of the number of facilities presented earlier by the Wastewater Needs Assessment team. I will note that there may be differences in number of facilities with waste discharge requirements or WDRs on this slide compared to facility numbers that'll be derived from the Wastewater Needs Assessment teams through the final facilities list. But this is reflective of how important the methods and definitions for terms are ensured to be meaningful and repeatable categories for future queries, comparisons, and iterations of this statewide assessment, particularly for our upcoming potential terminology for individual sewage systems discussion. With that, I do want to highlight the septic systems category, where over 1.4 million, including that 1.6 million unsewered California estimate earlier, These are all the on-site wastewater treatment systems estimated, which include septic tanks. Those are regulated under the conditional waiver of the statewide OTS policy, the statewide general order for small domestic systems, known as the Small Domestic General Order, or individual waste discharge requirement, WDR permits, as appropriate, just to name a few regulatory mechanisms that we use. These are typically issued and implemented by the regional water boards, and these numbers are estimates from September 2024. Now, how does the water board regulate these and under what authorities? Shown in the arrow and reading these out of order, as mentioned, waste discharge requirements may be set by the statewide or regional general orders, conditional waivers, or individual permits. WDR authorities are set by California Water Code. They're subject to the California Environmental Quality Act, the CEQA, known as CEQA, to minimally assess environmental and public health impacts, and discharges are classified as non-hazardous and don't qualify as landfill waste to be WDRs. Please note that there are extended details in the notes on this slide deck for the advisory group to have, such as for the California Code of Regulation Authority and title exemptions. And I'll speak more on that later. Go to the next slide. Okay, so focusing down now on on-site sewage treatment systems, which include individual disposal systems, community collection and disposal systems, and alternative collection and disposal systems that use subsurface disposal. I know it's a bit of a run-on mouthful. These on-site sewage treatment systems under the OTS policy as OTS, so they're kind of interchangeable terms right now, and some of the on-site sewage treatment systems as well as on-site wastewater treatment systems, OTS, both have definitions in California Water Code, and that will be, well, I'm getting ahead of myself, but those can include septic tanks for individual homes or small community systems. The OTS policy does have detailed standards or conditions, which we've summarized in an OTS resource document in the advisory group materials that have been, or we can distribute those, and water board staff are able to assist with any future questions regarding the OTS policy and other water board regulatory permitting mechanisms as well. Since it's come up a little bit, although the OTS policy can take incidental commercial and RV waste, this is usually someone's RV at their home. Most mobile home parks receive individual or other permitting mechanisms. Okay, lastly, I wanted to highlight a brief history. So how long has the water board been regulating domestic wastewater systems? A long time, as some as old as 1950, but surely at the adoption of California Water Code and its authorities, but focusing on more recent, particularly the water board's regulations of small domestic on-site wastewater treatment systems through our statewide small domestic general order. Those involve systems discharging less than 100,000 gallons per day on a monthly average, and the statewide OTS policy, which covers systems that are discharging less than 10,000 gallons per day, or some that are less than 3,500 gallons per day, depending on which regulatory tier. One of those tiers includes those local agency management programs for on-site systems mentioned by Dakota earlier. So looking at the timeline prior to 2000, each regional board provided permit or waiver conditions for these on-site systems. In 2000, legislation was adopted affecting the state water board to establish statewide standards ultimately set by the OTS policy and its conditional waiver. In 2014, the state water board, in part of its authorities, updated the small domestic general order. This superseded 1997 waste discharge requirements. The OTS policy then comes up again in 2018 and 2023, most recently because of its conditional waiver, needing renewal every 5 years per California Water Code. So again, there will be another renewal of the OTS policy and its conditional waiver in 2028. that's the last of my presentation. I hope this provides some regulatory overview. Again, there are slide notes and supplemental material that has or we can make available. Thank you all for your time, and I'll pass it back to Ariana.
Thank you, Stephanie and Greg. That was a lot of information. Let's go to the next slide. Okay. So we'll have a 5-minute break shortly, but first I just wanted to go over the breakout room format one more time. We'll have a brief break, then we'll have the breakout rooms. Okay. So these breakout room sessions are to discuss the 3 agenda topics. You have all been assigned to a breakout room. The breakout rooms are intended for advisory group members the time and opportunity to provide input on the 3 topics presented by the team. Again, the Wastewater Needs Assessment team will facilitate and take notes to support the dialogue during the breakout room discussions. But if you would like to provide comments or input on a breakout room that you are not selected into, there will be an opportunity to do so after the advisory group meeting. And I also want to remind everyone that we're having the breakout rooms discussion where we're each in our individual breakout rooms. Then we'll all come back into the main room and have an opportunity to discuss. And if you're not in the breakout room, I encourage you to ask questions during that time. As a reminder, we ask that one advisory group member in each room can volunteer to report on what you discussed in the room to the rest of the group. We recommend that you take the last 5 minutes or so in the breakout rooms to determine the main points that you will want to report back on. Are there any questions on the breakout rooms?
I don't think so.
And I had a whole slide that was obviously very beautiful to show you guys. But I already went over this material. Cool. Okay, then I think we could take a 5-minute break. Let's get back here at 10:55, if that works for everyone. Okay, thank you, ready for. So we have approximately 30 minutes left of the official time. Say we end at 12:15. I know the calendar goes until 12:30, so we do have some wiggle room if folks are willing to stay till 12:30. But now let's just say 10 minutes for each breakout room session to report back. And then folks can ask any questions about the given topic. So first we have the advisory group member reporter from breakout room 1, data collection, report back.
Hi, this is Mac McKenzie. So some of our notes we had for information or data gaps that we may have overlooked. There's mobile home park data. The Department of Housing and Community Development is a possible source of additional data that they issue permits and qualifications for septic systems for mobile home parks. So that was identified as a possibility. We had a note here that maybe somebody from the UCLA group could answer. We had a question about the 1.6 million unsewered versus the 1.2 million on septic systems, and you know, where's the 400,000 difference? How's the data collected on those? Is it just unhoused or homeless or transient? And then we talked about SB Senate Bill 244 for mapping water and sanitation. There are sewer shed boundaries identified, and they were included in the data collection, so those weren't missed according to Dakota. For the State Water Resources Control Board, there was discussion about possibly having an annual report that's more public and easier to digest for wastewater treatment plants, to be made public, similar to the Department of Drinking Water's electronic annual report. Specifically for WDRs, there's not as much data collection or public information on those. And then we discussed correlating geographically the locations of known OTS with existing WDR and NPDES facilities. There is machine learning models that are being developed. Nelson's model will be able to estimate unknown OTS based on geographically who can tie into where, and that's going to be more related to the feasibility of, you know, tying in individual sewage systems to existing systems, and then being able to also estimate which ones are unknown that are in other areas that are not near those collection systems. But Nelson said, De La Cruz said he'll have more information on that in the January 2025 meeting. So about the machine learning models. And that's what we had.
Thank you, Mac. Any questions, or would anyone from that breakout room like to add on to any points described? Go ahead, Debbie.
Okay, I wasn't in that breakout room, but I did have a question. One of the areas that was excluded was the wastewater reclamation facilities. And I was curious about that because I know, at least in the Central Valley, we have a lot of what would be normally wastewater treatment plants. They would name themselves that. So was further.
Yeah, we discussed that. So water reclamation facilities that were included that have the original source as, you know, sewage coming in as the original source and going out, those were included. But reclamation facilities that were using secondary effluent from an already treated facility were not included because they've already been treated to a level that's high enough for discharge. So if it's like Hyperion in LA and then the secondary effluent's going to another facility for reclamation or purple pipe, those were not included. But anything that was the original source was raw sewage was included.
Okay. And I'm going to ask a really similar question is, so for things like federal facilities and some of the state facilities, you know, whether it's the prisons or the army camps or however you want to put it, I say our military camp, was that looked at close so that housing, because some of the permits they have are for housing versus more industrial type activities, was that also looked at?
That'd be one for Dakota.
Yeah, so it was considered. So, and you know, as I'm explaining this, Laurel or John, if you want to jump in with clarifications, please feel free. So it was considered, and it's kind of a complicated question. And so I guess the first thing, well, complicated answer to a simple question, rather. The first, just say, you know, these groups that we've established are not set in stone. And if, you know, with enough discussion and reasoning, it's possible that some things might need to be added back in. The way we looked at those federal facilities and state facilities is, you know, we're kind of coming at it from both ends. There is the need to address like domestic human right to sanitation. That is the driving force of this project. But long term, there also needs to be kind of the concept of like projects that could be funded by the State Water Resources Control Board through a given mechanism. And the thought being that those state agencies might not, or federal facilities might not be able to pull from that state pool of funding. And so we're trying to balance, you know, the need to address where people are living permanently versus like, is this something that the state board can actually address and
Okay. I'm wondering if there's just a way to flag it differently or if it makes, I don't know. I mean, I just was one of those ones, again, being in the Central Valley, we have all of it. So we do have definitely state-owned communities that, you know, state and federal communities that, you know, where you have people live, it's just where their home is.
Right. And, you know, and maybe we do need to, instead of exclude them to set them aside rather to exclude them from our analysis completely. I think that's something for us to consider for sure.
Thanks.
Thanks, Debbie. Go ahead, Stephanie.
I was just going to respond to Michael's earlier questions about the numbers. So the estimated, they're estimations. The 1.6 million unsewered, that was from the 2021 American Housing Survey. And then the 1.2 million odds, the discrepancy in there is simply that the odds policy during its CEQA analysis conducted an estimation as well as a calculation to estimate future developments and projections for odds. Again, that was contained in our CEQA analysis. However, it was pulling from 1999 and 2000 and prior data sets. So it is something that is due to be revisited. But that's where that 1.2 came from originally.
Great, thanks.
Yeah, I just want to add really briefly to that, and then we'll talk about it in the next meeting. But those are the best available numbers we have, but we are aiming to produce better, more accurate numbers as a course of this effort, in the course of this effort, but we don't have those numbers yet. But there's really a shockingly little information available. And for instance, there used to be a question on the census that asked people at least about sort of the sewered versus unsewered distinction, but that hasn't been done since 1990. So a lot of the numbers you see are actually, you know, estimates extrapolated from the 90s or 2000 forward. Again, but the numbers are never going to line up exactly, given kind of the lack of attention to this issue historically, but we'll do our best.
Thanks, Greg and Stephanie. Go ahead, Keith.
For Dakota, just my thought is just on the exclusions, you know, what's a means test for exclusion? You know, you might want to consider getting everybody or getting it out there. Just what's the means test for an exclusion? If you start dealing with exclusions, that's all.
And it, just to Dakota, we're going to publish something that I think Office of Water Program has been really thoughtful about is having their assumptions or like the way that they went through the analysis documented. So the list and all of that datum is going to be available so it's not like they just drop off. There's going to be a list of excluded facilities, but it's great to hear some ideas on what to do with the excluded facilities from the primary list. And sorry, Dakota, I just wanted to chime in on that.
Yeah, no problem. Thanks, Laurel. Yeah, so then Keith, were you suggesting that we do like a means test in terms of like affordability, or did you just mean that it should be documented why we're excluding them?
Yeah, just documentation.
Okay. Yeah, perfect. So I think if you go into the materials folder that Ariana set out to the group, there is it's like a 2 or 3 page Word document that kind of documents our methodology and describes each category and when it was included versus where it's excluded, because some of the categories seem really similar. Some of the categories are coarse, and some facilities make sense to be considered in this assessment and others don't. But as Laurel said, all of that process, the list of included facilities and excluded facilities both will be recorded and made available to everyone throughout.
Thank you, Keith and Dakota. And I just posted the methodology that Dakota was describing in the chat. And that was just uploaded this morning. So if you were like, what? I didn't see that. It's because I did not do that till this morning. So my apologies. But we're at 11:55, so I also dropped in the chat the feedback form in case you have any additional questions about the data collection process. So please put your questions, feedback there, and we will be able to get to you in the coming weeks. But now we can have breakout room 2 for the baseline assessment report back, which will be Jared.
Hi, good morning. Really appreciated the discussion in the second breakout room. It was on ground truthing the baseline survey and infield validation. Samuel Sandoval shared with us that they're going to be going out into the field to talk to communities about 60 days worth of time on the road, wanting to make sure, what questions to ask, where to go. And so I thought it was a really good discussion. Professor Casey Walsh suggested using the definition that was developed, that water-related sanitation is access to safe, functional, affordable, and dignified collection and disposal of wastewater, and using each of those four terms to inform some of the questions that were asked when they went out. And because that's what, if it's going to be assessed on those terms, then you want inquiries that provide information to help that assessment. There was an observation that within the survey respondents, there wasn't a lot of response from sewer agencies themselves. And I think there was kind of an understanding they weren't the intended audience per se. There's trying to get a sense of the community need. But we thought as you shift into this next phase of ground truthing, when you do visit a community, that would be the kind of community that do an extension of service, doing some work maybe with a nearby sanitation agency that would be taking that on could be beneficial. And so CASA and Civicwa and the Clean Water Summit partners are happy to connect, more just to help identify that. There was also a thought that some of our members are doing these projects, and so that could be beneficial also to connect in those communities where this has been done, to kind of understand the need. There were some just good observations for distinguishing items. One was understanding, in the residential context, the renters versus property owners, wanting to distinguish that for ground truthing and surveys. Also, in these communities and looking at demographics, also considering soil type. And that kind of went to the nexus of water quality and wanting to understand in these communities, is there a water quality impact that an extension of service would be attendant to? And I think that tied to a broader observation that, using prior work, I think in one community, it was something like 20,000 homes to be connected would be about $1 billion. It was a very detailed analysis by an engineering firm for one service area. It was 5 years ago that dollar amount was put on, but if you extrapolate that out to the 1.6 million homes on septic, that would be something like $80 billion. And so there was kind of an observation that it seems like in a lot of the discussions so far, it's an assumption if it's septic, it's bad. And I don't think that's the case, but we wanted to just be thoughtful about making sure that that's not the default assumption, which I don't think it is. But then also, trying to look at that price, if it was 80 billion to convert everybody, round numbers, doing a few reductions, let's say they overestimated that amount, so cut it in half, it's only 40 billion. And if you're only going to do 10% of those homes, that's still $4 billion to do, I think, 120,000 homes, which is a fair amount of money. And so it kind of drove us to the sense of, in doing the ground truthing, that affordability piece of the definition is really critical. And so getting rate information and understanding, do these communities, can they afford the connection fee, which is 50 to 75,000, or if the water board is going to be able to finance and cover that part, can they afford the sewer bill? And so a lot of the work that our sewer members are doing to maintain their communities, the aging infrastructure, compliance with new regulations, that has impacts on wastewater pricing right now. And so that affordability piece in this kind of infield ground truthing, we thought would be also important to collect. So that later, as you're doing the assessment in these multiple stages down the line, you will collected that information early on and can incorporate it accordingly. And so I think the one last observation I was, would throw out there from our group was not so much discussed, but I had messages kind of throughout the meeting with other colleagues. And I think from a process standpoint, we're a technical advisory group, and I think we're all here serving because this is a really important initiative to us and we want to be advising. And so I think, I've heard from our folks, we would like a more frequent meeting, be it monthly or bi-monthly. And folks have alternates, so if they can't attend, then the alternate ideally could. But ideally, folks can decide their own level of involvement, but having more opportunities to be engaged and to check in on this, I think would be really welcomed and appreciated by us, because we are here and we really do have a lot of expertise across the academic, practitioner, and community, representatives. And so towards that end, I think we were all really appreciative of the presentation on the baseline survey that we heard, and we'd welcome being more involved going forward.
Thank you, Jared. And thank you for the broader feedback as well, for the frequency of meetings and level of engagement. I'm happy to hear that people are wanting to be so involved. And that is exciting that this project has a lot of momentum.
Marina, just
ahead,
one,
Sam.
one addition. Also, they mentioned that in some of these systems, so sewer or mobile home, mobile toilets, that we provide kind of the feedback on the good and the bad, because it was mentioned that it only seemed that it was on the bad side, the septic systems, and that there are also materials for maintenance or materials for addressing some of these issues or how to prevent them, that also will be included. And the one last thing is that a lot of people requested their feedback that we contact, so we can actually identify some of the communities that they may help us to contact. And on that one, a lot of thanks, also a lot of recognition and thank you to all of you that are doing really work on the ground to make things change. So I think that's on our side, right, Ariana?
Yeah, thanks, Sam. I want to open it up for anyone, either in the group who wants to add any additional comments, or folks who were not able to be in the breakout room. But go ahead, Keith.
Hey, yeah, Samuel, I just wanted to clarify something that we're dealing with. We're dealing with the individual systems that don't. We aren't talking about dealing with gray water or individual sewage systems or individuals that have established a gray water system, like in Texas, where they use the 5-tank system. In RV parks in Texas, where the last tank is the tank that's treated with chlorine, and it actually goes out into the sprinklers and waters the lawn. We're not dealing with at that level yet, are we? I want to make sure that.
No, not yet.
No. That's a no.
Yeah,
I didn't hear you. I'm sorry.
No.
Okay. Thank you.
Thank you, Keith. Any other folks have questions on either the baseline studies review or the survey, and the future efforts for the in-field validation efforts? And I see in the chat that we have a question. Is experienced operational labor and availability also included in the economic analysis? Not sure what the economic analysis necessarily is referencing.
Yeah, could you be more specific about?
It's kind of not
the
clear
analysis?
what the question is. Yeah, what these might mean.
It might mean that does the community have, operators to tend to these extensions of service, perhaps, but that's what what I was
So
thinking.
I'll say, to the extent that those data are available, they will be incorporated in the inadequacy and risk analysis, which we'll start to discuss in the next meeting. And then certainly when it comes to systems that are assessed as inadequate, in particular, is sort of one of the potential solutions, maybe more for more highly trained operators, and the cost of that would be assessed in that portion of the analysis. It's going to be estimated, really, but I wouldn't see where that would be incorporated in other parts of the analysis, and not in any that we sort of covered today, although certainly, questions around trained operators could be asked in the field work, I would assume.
Great. Yeah, this is Jean Sabin. Sorry for the incomplete and unspecific question. Some sort of, I had heard a risk analysis reference somewhere, so that's great. If there's just a dollar amount attached to operational experience, especially for rural and disadvantaged communities, I think that'd be beneficial.
Yeah, thank you.
Okay. Go ahead, Lucia.
Yes, I had a question related to the field campaign. I'm just wondering what is the timeline on that? And also during the process when you're visiting those sites, are you going to be looking for like failing systems there as well to just market, we have talked to these people and it seems like they are failing, or what is the plan there?
So the second part is yes, if you know. So we are requesting the feedback or locations. So if you can provide us some locations, so that will be great. Timeline, we will start on the logistics. Well, we already started, but more formally November 1st. We'll figure out some of the dates. As Jared mentioned, between 45 to 60 days. That's a lot of field work. We're gonna do it by regions. So we will kind of do a trip in a region and then come back. So we'll let you know of those regions. I'm happy to hear from you. We are writing down your name for contacting you for some of these. Thanks.
Thank you.
Yeah. Thanks, everyone. And thank you, Breakout Room 2, for the discussion. Now we'll move to Breakout Room 3 for the individual sewage system terminology definitions. And I believe Paul Burke is the reporter for that.
Yeah, so we had a good discussion. One point is that we have a glossary of many terms, and we want to continue to keep that glossary and expand it, and had some suggestions from the group about UN and other terms that are worth including in the glossary. And then in terms of the category that we liked the concept of unsewered, and then the OWTS in the law is defined as subsurface disposal. There was a comment that whatever terms we have needs to be clearly translatable into Spanish, and those probably are, but they can be tweaked as needed. We need to translate them, see how that works, and if necessary, come back and address them. We also heard about the need for further discussion about how and where these terms will be used for categories and the environmental analysis, the permitting process, funding sources, all may have different implications for the terms that we use. We did hear that the subsurface disposal will be covered in the unsewered estimates, and we'll wait to hear in January more detail about that. Other members of the group have things to add to that?
I see we have a comment in the chat. Chat, if you'd like, you can say your comment out loud, otherwise I could read it right now.
Sure. Yeah, I'm not a member of the advisory group, so just adding, I kept quiet during the discussion, but one of the things that came to mind in listening in was, a desire to have a term that would encapsulate everything under unsewered that, would include transient collection systems and on-site storage for off-site disposal, but that would also include outs and other on-site treatment and disposal systems. And so it's just suggesting a potential term for use might be unsewered domestic wastewater management systems. So that would include systems that don't dispose on site, don't necessarily do treatment on site, and includes transient collection systems.
Thank you.
Thank you.
Any folks from the breakout room or those who were not a part of the breakout room who have questions, please raise your hand.
Great idea, Chad.
Yeah, I would just add, I know in the space, it probably takes folks some time to think about terms, although congrats to Chad on being able to bust one out on the spot. But, feel free, especially use the form to provide your input on terms and terminology. But I also see, we already had some discussion chat on the exact terms. So I think I'd encourage everyone to reflect on it and do submit, specific terms, either existing or new, if you think they work, and we'll take those all under consideration. But I see, Chad, you have your hand raised again.
Yeah, just one comment about the inclusion of the word domestic was just to make it a little more clear that it wasn't any other sources of wastewater, that it would be limited just to domestic wastewater. Theoretically, you could have other sources of wastewater that could be stored on site and disposed of off site or whatever. So that's all.
Thank you. Okay. Any other questions from the ISS terminology breakout room or feedback? Go ahead, Jared.
Yeah, I had just received a question from one of our members, and it pertained to some waterless sanitation options and some of the affordability on scale. Those might being better solutions than connecting to sewerage because of the cost. I don't know if that has been considered or incorporated into this, but flagging that. And then I also some comments on the definitions, which I'll send in by email, if that's okay.
Yeah, thanks for the first comment. I think that gets more into the sort of solutions end of things. So I don't have a firm response, except to say, again, that we're not considering or proposing an analysis of the integration of all on-site wastewater treatment systems or unsewered populations into existing collection systems. And certainly in situ interventions make a lot of sense economically and feasibility wise where possible. I'm not sure the extent to which we can model or estimate those, but yeah, I mean, your comment is noted, and I think will be considered. Stephanie?
Thanks, Jared.
Yeah, I apologize. My internet's been cutting in and out. In case I missed it, I just wanted to add from the group discussion that there was a lot of talk about wanting to have continued discussion on this topic because it's a work in progress and generating. So
Thank you, Stephanie. Okay, I think, let me get my slides right and I could share my screen again. Okay, cool. So we're at the end of the meeting. That's all we had today. So thank you everyone for the participation in the breakout rooms and sitting through the presentations. We really appreciate it. Our next advisory group meeting will be January 24th, 2025, and we'll present on the risk and adequacy update, as well as provide an overview of the future mapping efforts that were kind of hinted at earlier in this meeting. And we'll share all the resources to prepare you for that meeting in advance. And we'll also follow up by next week with all the meeting materials and the additional feedback form. You already have the additional feedback form. I sent it in the chat as well as via email, but I'll send it again so that you guys can provide comments on any agenda topics. So that's all the content that we had, but I want to ask folks if they have any questions. So please feel free to raise your hands. I think some of us can stay on. The meeting invite goes until 12:30, so we do have some time. Also, I know this was a 3-hour meeting, so I really appreciate all you guys staying with us for so long. But go ahead, Jared.
Oh yeah, I just put it in the chat, but maybe if possible to send out a survey to folks to see if they could meet before January. I think you'd probably have more than a quorum to have discussion, and I think it'd be good to have some more follow-up on the developments. You know, I think this report's coming out in January, and none of us have even seen, you know, the report before its release. And so I think there's a sense as a technical advisory panel, we want to have more opportunities to be involved with all this great work and support you on that.
Thank you, Jared. Go ahead, Laurel.
Just really quick, I think there's I don't want to speak out of turn, but with the report, it's being drafted, and I believe that the final is May. I saw the January date, but I think there's a time frame in there, Jared, of when the final phase 1 report is actually final. So, you know, that, sorry if that was confusing. I think that there is going to be an opportunity for this group to weigh in on that report before it's an actual final public report, but I will defer to Greg and others.
Yeah, I'm sorry. The January 2025 date is just for the phase 1B, the survey and the baseline assessment, not for like the final phase 1. So my apologies if that was confusing. The phase 1 final report, we're still trying to decide how that format will look, but we anticipate a first draft-ish being available in actually June for phase 1, but that still needs to be decided how we want to format that. Go ahead, Keith.
Ariana, are we bound by the Brown Act rules, or can we communicate with each other on an individual basis?
Yeah, we're not bound. You guys can communicate with one another. I've sent the email, everyone's contact information. I believe I sent that out after the last advisory group meeting. So you should have that, but I can send that out again.
Thank you.
Go ahead. Yeah, go ahead, Eric.
Yeah, I was just going to clarify, Ariana. I know you were in the baseline survey breakout group, but multiple of the advisory committee members talked not only about the phase 1 survey, but also about the phase 1B products, like the baseline report. And so we just want to make sure we capture that. And at least for our part, we can definitely see what we can do to make sure we get input from all the expertise on the advisory group.
Thank you, Eric. What do you have?
Yeah, I wanted to echo the same comments that Jared made. More frequent meetings will help, because I feel like this meeting we covered a lot of ground, but it was too fast to process everything, although I had information prior to the meeting, which I really appreciate. But again, listening to other people, that really opened my eyes to other concepts. So the breakouts were really informative, but again, like I would want to hear everybody's opinion. I missed out on the other two, so.
Thank you. Yeah, I hear you guys on more frequent meetings. With the way that this advisory group is set up and how it works, it does take a lot of effort to plan the meetings and get the materials together. So we will see what we could do about the frequency, and we'll especially because the water board, the board itself is very interested in this meeting. And because of that, we typically have to have publicly available meetings, which require additional processes for logistics. But I definitely hear you guys on wanting more frequent meetings, and we'll discuss internally how we can accommodate that. Any additional questions?
Just want to say thank you, everybody. Have a good weekend.
Yeah, Ariana, I'm curious with that comment on the resourcing for a meeting, would something more like office hours or something like that kind of create a way to have check-ins and dialogues for those who are interested on certain aspects to maybe help get around some of the formality and the resource constraint of a formal meeting?
Yeah, I'm just going to say we hear you. We're going to have to follow up. We're not going to make any decisions on this call, but we certainly hear the desire for more input and discussion. But I don't think we can commit to a new structure. You're welcome to make comments, I guess, in the remaining 10 minutes or via the form regarding desired formats, but we're going to have to weigh sort of the considerations Ariana mentioned, as well as the consideration, I will note, that we actually, this is not a technical advisory group. We dropped the term technical explicitly to have a wider net and to hold these meetings with a sort of a wider group of folks. So these meetings in particular, they wind up being technical because it's not easy to not get technical, but that's why they're explicitly designed to certain intervals and to be at a bit of a higher level. And that's why we dropped the term technical from this particular advisory group. So that has to be kept in mind in balance with what we're clearly hearing is a desire for more engagement, discussion, questions on the technical details.
Go ahead, Jean.
Yeah, Jared, I agree with you. It's quarterly meetings, especially in such a large group, is maybe not as effective going forward the next 3 years. I appreciate Mr. Pierce's point that the project team has their own resource limitations. I haven't heard anything that limits us as advisory group members to start a monthly meeting together. So I think that may be an avenue that we can explore.
Thank you. And I want to say that we do appreciate the participation and the excitement around this project. It's nice to have so much enthusiasm for this and makes it all the more exciting to complete. But any other questions for this meeting or for future meetings?
Ariana, it's not really a question, but just kind of more of a comment is really, I do think that I really liked the comments about being able to kind of have more of that discussion. So I wanted just to put my thumbs up on that part too, as there's a lot of I feel like this group is diverse and it's good, but it's hard to do that in a 20-minute session, quarterly. So the more discussion that we can have in order to help guide us and everybody bring their expertise, that would be great. So thanks.
Thank you, Debbie. Okay. I'll pause again for any additional questions. But want to thank everyone for, spending their Friday morning, for those of us on the West Coast, with us. And I know this has been a very long meeting. There was a lot of content. You guys should have all the materials. I'll follow up with any additional materials and the feedback form. But just really want to say our appreciation and thanks for your time and your expertise and your comments and your general enthusiasm for this project and moving the wastewater needs assessment forward.
Thanks, everyone.
Yeah.
Thanks, everyone.
Thanks, everybody.